Hey YouTube. Sorry, trying to get this camera thing right. So I've been wanting to vlog so much, but me and my husband ended up moving to a new city, practically a new state. So that put me off, and we don't have internet yet. So I'm doing everything on my phone because my camera isn't working. But anyways, hey new grads. So you just finished nursing school, just graduated, um, trying to figure everything out, what you want to do, where you want to go from here. And I just want to share my tips, everything about nursing that I wish I'd known. I wish I would have known when I graduated. So, um, as for me, I've been a nurse for a little over 3 years now. I do have my BSN. I'm a registered nurse, and I love what I do. I started off in the medical ICU, which was a little challenging as a new grad. Then I ended up going to Med Surg, and now I'm back in critical care. I'm at CCU. So my tips on nursing, I hope this is helpful. Tip one, always learn your basics before you even go to your new job or whatever. Just make sure you kind of read up on everything, refresh your memory from nursing school, go to YouTube, look up different things, just research everything you can. Um, so yeah, I would say research and learn everything. Get familiar with your basics, your labs, your report. Figure out how you're going to do your report. Figure out where everything is on your floor, where your floor is before your first day, parking. You need to know all that because some places you cannot park where you want to park on your first day. And on your way to work, the security guard will come out and tell you to move your car. And you don't want to be late on your first day, and that will make you late because usually the nursing parks are way in the back somewhere. So yeah, have everything ready. Go ahead and tour. Go ahead and have all your pencils, paper, clipboard, calculator, stethoscope, pen light, scissors. I can't tell you how many times with this new job on neuro floor that I needed scissors, and it's always for nicotine patches. And sometimes I would forget my scissors, so lately that's the first thing I grab is a pen and scissors. So yeah, just get everything you need. You'll eventually know what you need once you've been on your floor for a while. So what I wish I would have known in nursing school, for one, if you can get out find some little cards that can clip onto your ID with lab values on it, and also like insulin, your times for them, how long it takes for them to act. Those are some important things you need to know because nursing nowadays, everybody it seems has diabetes in the hospital, so you're always giving insulin constantly. So you need to know those things. Know your labs back and forth. And if you don't know them, if you have a little card with you that you can put in your pocket or on your ID, that would work great. Next, I would say the thing that I got from the floor in med surg that I would think I would like a lot, that did help me a lot. I got it from another nurse that was on that floor for a while, and she gave me a little report sheet. It's like an Sbar sheet. I don't have it with me, so one day maybe I'll be able to bring it and show you all. But on that sheet, it's very helpful. So get your pen out, get your paper out, and write this down. On the Sbar sheet, on the report sheet, we call it Sbar in nursing, but on the report sheet, the major things you need to know when going to work. You want to know the patient's name, room number, birthday, age, gender, their admitting diagnosis. You want to know their code status, full code, DNR, DNR 1, 2. You want to know their allergies. And then to go more detailed, you want to know their alert status, alert times 1, times 3, intubated. You want to know their oxygen settings, so if they're on room air or if they have ventilator or nasal cannula, whatever they have going on. You want to know if they are independent or if they need assist with 1 person, 2 person, 3 person, You want to know if they can turn from side to side by themselves, pull themselves up in the bed. Even though those are things you think the nurse tech needs to know, no, those are things you as a nurse need to know because you will be doing it. You cannot depend on nurse techs, especially as a new nurse. You need to getting into the routine of doing it yourself. The floor I work on now, we don't even have nurse techs, so you need to know that type of stuff. You need to know if they're continent or incontinent. Suprapubic catheter, you need to know the size of it and how much water is in it to inflate the balloon. You want to know their history, the patient's history, the patient's doctor, admitting doctor, and hospitalist. You want to know their history. You want to know, what else? You want to know their VTE. What do they have for VTE? At most hospitals, aspirin does not count as VTE. At one of my old hospitals, VTE, if it was walking for VTE, you actually have to put an order in the computer stating patient is to ambulate for VTE. You actually have to write that. It just can't be a standing order. It has to be a doctor's order. Or it can be heparin, Lovenox, something like that, Coumadin. Also, if they are on heparin, make sure it's clarified if it's a heparin drip or heparin sub-Q. Next, need to know is their diet. What type of diet are they on? Are they a feeder? Are they able to swallow pills whole? Do you need to crush the pills? How does the patient like to take their pills? Whole, as a regular person, how many pills at a time can they take? If some people even like to put the pills in the applesauce without crushing them, but if that's how the patient likes it and that's what works best for them, that's what you should do. You need to know their aspiration precautions. You need to know if they even need a speech evaluation. If for some reason you're giving pills and you notice the patient's not doing good in coughing, go ahead and let your doctor know ASAP. Do not give them anything else. Talk to your doctor and let them know what's going on and see how they want to proceed from there. So you want to know that. You want to know if the patient should be able to use a straw or not, because sometimes dietary or the speech therapist will tell you that it's better for them not to use a straw. So you want to know their diet. You want to know if they're blood sugar check. So you need to know if they're ACHS, BID, TID. Sometimes when they're not eating, or if they're on PPN or TPN or a peg tube, you need to know when exactly to take their blood sugar. So yeah, just know their blood sugar check. And you want to know the patient's last set of vitals. What's pretty much their baseline. You also want to know any critical labs or their most recent labs. You want to know that. Any tests, procedures, surgeries coming up today, if they got any blood, or if they're scheduled for anything pertinent today, or if they had any events overnight, or if you're night shift, if they had any pertinent events that happened in the daytime. You want to know if all consents are signed already, if you are having a patient to go for a procedure. I feel like I'm missing something. Oh, skin. Yes, skin. Always cover yourself. Do a skin check at the beginning of your shift with the nurse, because if the nurse leaves and they told you their skin was intact, that nurse leaves and you already signed off and agreed with that nurse without looking at that patient's skin, and you find something during your shift, that will be on you. You cannot say, well, we did a skin check, but we didn't really look at the skin. I just went off of what the nurse said. No, this is your license, so cover yourself and go ahead and check the skin with the nurse. Always do a skin check. So you need to know if they do have skin issues. You need to know the last time the dressing was changed. How often are we to change it, and what supplies and materials that you need in order to change the dressing. And if it's a wound vac, you need to know the settings on that. And if you for some reason don't know how to work with a wound vac, at the beginning of the shift you need to make sure you have the charge nurse number or the wound care team nurse's number, so you can already maybe ask for education and learn how to do it yourself. Um, you want to know, as for me and the floor I work on right now, we don't have nurse techs, so you want to know if the patient has had a bath or not, because you need to know if they're scheduled to get one on your shift or will it be the next shift. So that's something you need to know. Um, if they're on ventilators or anything, you need to know all of their settings. And that's pretty much it. That's what's on a report sheet. So if you can make a report sheet with those few things on it, those are your basic, those are your need to knows when you get in nursing, when you get on the floor. Just make a report sheet before you even see your patients, before you talk to a nurse. Go ahead and have those things written out on a little chart or however you want to do it. And then it'll make it easier to just fill it in when you get report from the nurse. Also, you want to know your medications. If you can, write them out throughout the day. Some people just remember them, but I'm the type of person, I like to write my meds down with the time and, go throughout the day with that so I can make sure I'm not missing anything. I never really write my meds down for the whole day because usually doctors go in and add and take away and add and take away all day, especially in the ICU. So I guess it depends on where you work and what they're used to doing, but make sure you keep up with your meds. Um, and that's pretty much all the tips I have. Those are like my little Sbar report sheet type tips, things you need to know on your first day or any day while you're going to your new job. I'm so proud of y'all for becoming a nurse. We need so many nurses. We need so many more nurses because it's a shortage. And like I said, I'm new to this. I'm still learning so much. There's so much in nursing, so many things you can do, so many places you can go. But I love nursing. It has its days. If you're ever having a bad day and you feel like you're behind, just take a deep breath. If you need to go somewhere and cry it out, I did that on my first day of nursing. Off orientation by myself. I had a patient die my first day off of orientation. But he was a DNR and it was kind of expected. But like, if you need to go somewhere for a second and just vent or let it out, do that because you don't want to be overwhelmed at work and you have people that need you. So you got to take care of yourself and take care of them. Um, so yeah, I'm so proud of y'all for becoming nurses. If you have any questions, you can write me on here and I'll get to you as soon as possible. Um, yeah, any questions from the new grads or if you're not a new grad and you feel like it's something I said that was encouraging, interesting, or something that you want more clarification on, you can just ask me, okay? And that's all from Cammie Ray. Cammie's Cam here, nurse, and I'm out. Bye.